I'm Dr. Benedict Raj. I'm a cardiac surgeon with special interest in pediatric heart surgery, that is, children with heart disease. I work out of Columbia Asia Whitefield, Bangalore. At that time, there are many questions that come to us. The first question is usually, Doctor, how was the operation? During the stressful period of surgery and recovery, whatever we talk to them flies past. We document it because we know they forget it. And then we show them that we have explained everything, and we go back through the things and tell them exactly until they understand what has happened. And once they are happy with all that, we get ready to discharge the patient. So the average ICU stay for most of our patients is about a day or two. And then another common question among young parents is, will my next child have heart disease? 97.5% no. That is statistically speaking. If you have 10 children, the chance is still 1/4. And nowadays with 1 or 2 children, I don't think that's going to happen. So let's not worry about what may or may not happen. I always advise the parents of my patients that they should go in for another child. Having a normal child as a second or third child is really going to help the family overcome the stresses involved in looking after a child, especially when the heart disease is not curable. The other question that I'm asked is, when do I come back for review? Normally, when we send a child home, if he's from Bangalore, no issues. They can come to me after a month or so, because I know if there's any concern, they'll come straight back to the hospital. The emergency will call me and we'll coordinate the care of the child. 1 month, 3 months, 6 months and yearly follow-up until we declare that the child has totally recovered and has got no structural heart disease. You have to keep coming back to us just to make sure that we are following up the child's recovery. In a patient who has come from a foreign country, we keep them for a week in Bangalore. Review the child after 1 week to make sure everything's fine. And again, just before they go and catch their flight, we do a complete review of the patient and give him a certificate saying he's fit to fly. And that way, the doctor who receives the child in the native country sees our reports and understands what all we have done. The beauty is the English language and the common words we use in medicine, all over the world they're standardized. Wherever you're from, your doctor will understand what we have written. Another common question in India is when parents ask me, is it okay if the child runs? A child will only do things that will not affect him negatively. So if it is going to be difficult for him to run, he won't run. If he falls down, it's okay, because the child has a self-protective mechanism inside himself. He will look after himself. That doesn't mean you let him do everything. Pain will protect the child. He will look after himself. You have to be supportive. Is it okay to lift the child? What should we give him to eat? What should we not give him to eat? Are the next 2 questions that I get. I say, let the child eat what he wants. He will start growing hungrier in the next month, and that will enable to put on the weight that he did not put on all these months. And there's no food that I say don't give the child. Whatever we eat at home, simple, straightforward food is fine. We don't need any specific nourishment for a child. A good, normal, middle class food is good enough for any child. The other question is, can I carry my child holding the chest for the first month and a half, for about 4 to 6 weeks that is? The bone, especially the chest bone, has been opened. It takes that much time for the bone to heal. And once it's healed, you can carry your child, nothing will happen. But for that period of time, I would suggest you support the back and the bottom of the child when lifting him up. For a bigger person, for an adult, it is up to 8 weeks, sometimes 10 weeks for old people for the bones to join. For that period of time, we have to be a little careful. But otherwise, the body heals so well, you don't have to worry much about all these things after this period of 1 to 2 months. The next question people ask me is, which doctor, which specialist have I got to show my child? You are showing your child to a doctor who found out the problem, which means he's a good doctor. Go back to the same person. He will understand what all we have written. If he has a doubt, he's free to call us and talk to us. We are here to clarify his doubts. So you do not have to come back to us every time for everything. we can coordinate with your doctor to give you the best care. The last question is, can I give immunization? I missed out on 2 immunizations previously. For the first month after surgery, because we usually use blood in these children, their immunity is low. So if we give a vaccine, any immunization, the response to immunization is not very good. And live vaccines can be harmful to the child because the child's immunity is bad. So in that situation, we do not give immunization for a month or a month and a half. And once the child's immunity picks up, you will see the difference by the way the child becomes active, bright, smart, starts running around, eating well, and looks like a normal child. And that is when he's going to start feeling very hungry and he's going to grow faster. Though the child with heart disease will never grow to the same level as he would have without heart disease, nothing stops him from being who he wants to be. And if there are any more questions, please add it to the comments and we are happy to answer them.